Welcome to the Longevity Lab. I'm your host, Sarah. We often think of life as a series of loud moments, celebrations, conversations, the hustle and bustle of our daily routines. But there is one thing that works in constant rhythmic silence inside us every second of every day: our heart. For many of us over the age of 50, we've been taught to look out for the big one, that dramatic Hollywood-style chest pain where someone clutches their heart and collapses. But here's the reality. For many seniors, heart disease doesn't scream, it whispers. It speaks in a language of subtle shifts, mild discomfort, and strange fatigue that we often dismiss as just getting older. Joining me today to help us decode these whispers is Dr. Michael, a renowned cardiologist specializing in preventative aging. Dr. Michael, thank you for being here. Why is it that as we age, a heart's SOS signals become so much harder to recognize?
Thank you, Sarah. It's a vital topic. You hit the nail on the head. The Hollywood heart attack is actually quite rare in the elderly population. As we age, our nervous system changes. Conditions like diabetes, which are common in our 60s and 70s, can blunt our pain receptors. This means a heart could be struggling or even undergoing a myocardial infarction without that classic crushing chest pain. We call these silent heart attacks. Instead of pain, the body might send out a feeling of profound exhaustion or just a sense that something isn't right. Because these symptoms are vague, people wait, and in cardiology, time is muscle. Every minute you wait to recognize a signal is a minute where heart tissue could be lost.
Time is muscle. That is a phrase that should stick with everyone listening. It's terrifying to think that we could be having a major medical event and not even feel pain in the traditional sense. You mentioned that this is particularly true for women and those with diabetes. Why is there such a gender gap in how heart symptoms manifest?
It's fascinating and tragic. Women's heart disease often affects the smaller vessels, what we call microvascular disease, rather than the large main arteries. This leads to symptoms like shortness of breath, nausea, or back pain, rather than chest pressure. For years, women were sent home from emergency rooms because they didn't have classic symptoms. We're changing that now by educating people to listen to the entire body, not just the chest. If you're a woman in your 60s and you suddenly feel like you've run a marathon just from doing the dishes, that is your heart whispering to you.
It's about recalibrating what we consider a warning. We've been trained to look for a fire, but we should be looking for the smoke. But how do we distinguish between the normal fatigue of a busy day and this cardiac fatigue you're describing? Is there a specific flavor to this tiredness that should make us stop and take notice?
Yes, and that's exactly what we're going to break down today. There are three very specific, very strange warning signs that most people ignore because they don't think they have anything to do with the heart. For example, did you know that a persistent ache in your jaw or your neck could be the first sign of a blockage? Most people call their dentist, but they should be calling their cardiologist.
A jaw ache? That's incredible. We're going to dive deep into these strange symptoms in the next segment. If you've been feeling unusually tired or have aches you can't explain, you won't want to miss what Dr. Michael has to say next. We're back with Dr. Michael, and we're talking about the silent heart. Dr. Michael, before the break, you mentioned that heart distress can show up in places far away from the chest. Let's get specific. What are the three most common, unusual signs that our listeners over 50 should never ignore?
The first one, and perhaps the most common, is profound, unexplained fatigue. Now, I'm not talking about feeling sleepy after a late night. I'm talking about a sudden, crushing exhaustion that makes simple tasks feel impossible. I had a patient, a very active 68-year-old woman, who told me she suddenly felt like her arms were made of lead while she was hanging laundry. She thought it was just the humidity. 2 days later, she was in my office with a 90% blockage. This type of fatigue happens because the heart is struggling to pump enough oxygen-rich blood to the muscles. If you find yourself needing a nap after a task that was easy last month, that is a red flag.
Lead in the arms. That's a very vivid description. And what is the second sign? I think you mentioned the jaw earlier.
Exactly. The second sign is radiating discomfort in the jaw, neck, or back. Our nerves are all interconnected. Often the pain signals from the heart travel up the spinal cord and crosstalk with the nerves going to the jaw and neck.
People often describe it as a dull ache, a feeling of fullness, or even like a toothache that won't go away. The key differentiator here is that the pain often gets worse with physical exertion and gets better with rest. If your jaw hurts while you walk but stops when you sit down, that isn't a dental issue. That is a heart issue.
That is a crucial distinction. It's the relationship to movement that matters. And what about the third sign? I've heard that the stomach can sometimes be a messenger for the heart.
You're absolutely right. The third sign is persistent indigestion or nausea. This is the one that sends the most people to the wrong doctor. Because the bottom of the heart sits right above the diaphragm and the stomach, a heart attack can feel exactly like severe heartburn or acid reflux. I've seen many patients reach for an antacid when they were actually having a cardiac event. Again, look for the pattern. If you get heartburn every time you go for a brisk walk, but not when you eat a spicy meal, your heart is trying to tell you that it's under stress.
It's almost like the heart is a ventriloquist, throwing its voice to different parts of the body. It's the jaw, it's the stomach, it's the arms, but there is another part of the body that acts like a pressure gauge for the heart, and that's our legs. Dr. Michael, why do cardiologists always ask to look at a patient's ankles?
That is because your legs are the end of the line for your circulation. If your heart is losing its squeeze, what we call congestive heart failure, it can't pull the blood back up from your extremities efficiently. Gravity wins, and fluid starts to leak into the tissues. We'll talk about how to check your own legs for these signs and what your breathing says about your heart's health in the next part.
We often think of swollen ankles as just a sign of standing too long, but as Dr. Michael just explained, it could be the first sign of a failing pump. Stay with us as we uncover how to read the signs from your lower body. Welcome back to the Longevity Lab. We are learning that the heart isn't just a pump in the chest, it's a system that involves the whole body. Dr. Michael, you mentioned that the legs can tell us a lot. For our listeners at home, what should they be looking for when they check their ankles and feet?
There is a simple test you can do called the pitting edema test. If you notice your socks are leaving deep indentations in your skin that don't go away for several minutes, or if your shoes feel tight by the end of the day, try this. Press your thumb firmly against the bony part of your ankle for 5 seconds. When you lift your thumb, if a pit or a dimple remains in the skin, that's a sign of fluid retention. While there are many causes for swelling, in the context of aging, it often means the heart is struggling to keep up with the volume of blood, causing it to back up into the legs.
And does this swelling usually happen in both legs or just one?
Usually, if it's a heart issue, it happens in both. If it's only in one leg, it might be a localized issue, like a blood clot or a vein problem, which is also serious but a different diagnosis. But here is the next level of that backup. When the fluid gets too much for the legs, it starts to back up into the lungs. This leads to the most common symptom I see in my clinic: shortness of breath.
Now, this is where it gets tricky. Many of us think, well, I'm 70, of course I get winded when I walk uphill. How do we know the difference between out of shape and out of heart power?
It's about the new normal. If you could walk around the block comfortably last month, and now you have to stop twice to catch your breath, that is a change in your baseline. But there is an even more specific sign I want everyone to listen for: orthopnea. This is a medical term for shortness of breath that happens when you lie down flat. Does your heart start racing, or do you feel like you can't breathe when you put your head on the pillow? Do you find yourself needing to prop your head up with 2 or 3 pillows just to sleep comfortably?
I've heard many people say they sleep better in a recliner chair. Is that related?
Exactly. People often think they are doing it for their back or their snoring, but many times they are subconsciously trying to keep that fluid from settling in their lungs so they can breathe. If you find you can no longer sleep flat on your back, your heart is asking for help. It's a classic sign that the heart's pumping chamber is weakening.
So we have the jaw, the stomach, the arms, the ankles, and our sleeping position. It's a lot of data points to keep track of. Fortunately, we live in an era where we have more than just our intuition. We have technology. Dr. Michael, I want to talk about the digital heart. Can our smartwatches and home blood pressure cuffs actually help us catch these silent signals?
They are the biggest revolution in preventive cardiology we've seen in decades. But like any tool, you have to know how to use them, or they can cause more anxiety than they solve. We're going to discuss how to turn your smartphone or your home monitor into a life-saving medical device right after this.
Don't go anywhere. We're about to learn how a 60-second check at home could be the difference between a normal day and a trip to the ER. You're listening to the Longevity Lab. We've been talking about the silent signals of the heart. Now let's talk about the tools we have in our pockets and on our wrists. Dr. Michael, many of our listeners have an Apple Watch or a Fitbit. They often see these notifications about high heart rate or irregular rhythm. Should we trust these devices?
The short answer is yes, but with a grain of salt. These devices are excellent at catching one specific silent killer, atrial fibrillation, or AFib. This is an irregular, often rapid heart rate that can cause blood clots, which leads to strokes. Many people have AFib and have no idea because it comes and goes. A smartwatch that monitors your heart 24/7 can catch those blips that a doctor might miss during a 10-minute physical. If your watch tells you your rhythm is irregular, don't panic, but do make an appointment for an EKG.
What about blood pressure? We all have those cuffs at home, but I see people using them incorrectly all the time. What is the Dr. Michael way to get an accurate reading?
Most people take their blood pressure when they are stressed or right after they've walked into the house. That's useless data. To truly see what your heart is doing, you need your resting baseline. Here is the protocol. Sit in a chair with your back supported and your feet flat on the floor. Don't cross your legs. Keep your arm at heart level. Sit in total silence for 5 minutes. No phone, no TV, no talking. Then take the reading. Do this twice, a minute apart, and average the numbers. That is your true blood pressure.
5 minutes of silence. That sounds like a meditation session. But why is it so important to be that still?
Because as we age, our arteries become stiffer. This is a natural part of the aging process called arteriosclerosis. Stiff arteries make your blood pressure much more reactive. If you've just had a cup of coffee or you're annoyed at a news segment, your reading could jump 20 points. We want to know what your heart is doing when the noise of life is turned down. If your resting systolic number, the top number, is consistently over 130, we need to have a conversation about protecting your heart.
And for those who don't like tech, is there a manual way to check in with the heart?
Absolutely. The 60-second pulse check. Once a day, just feel your pulse on your wrist. Is it steady like a drum, or is it jumping around like a squirrel in a cage? Is it too fast, too slow? Just getting to know the rhythm of your life can make you much more sensitive to when things go wrong.
It's about building a relationship with your own body. We check our bank accounts and our weather apps every day. Why not check the one engine that keeps us alive? But now let's get to the most important part. If we've noticed these signs, the fatigue, the swelling, the irregular pulse, what do we do? Is it too late to turn things around?
It is almost never too late. The heart is an incredibly resilient muscle. In our final segment, I'm going to give you a 7-day plan to start strengthening your silent heart and reducing your risk starting today.
A 7-day plan for a stronger heart. Stay tuned because this could be the most important week of your year. We've reached the final part of our deep dive into the silent heart with Dr. Michael. We've learned the symptoms, the tech, and the hidden warnings. Now, Dr. Michael, give us the heart restoration plan. If someone is listening and thinking, I need to do better, where do they start?
Let's look at the next 7 days as a reset. Day 1 through 3, the sodium audit. Salt is the hidden enemy of the aging heart. It causes you to retain fluid, which increases blood pressure and makes your heart work harder. For the next 3 days, don't just stop using the salt shaker. Read the labels. You'll be shocked to find that your healthy bread or canned soup has 50% of your daily salt. Aim for under 1,500 milligrams a day. Your heart will literally feel lighter as you shed that excess fluid.
That seems doable. What about the middle of the week?
Day 4 and 5, the interval walk. We know exercise is good, but for the heart, variety is better. Instead of a steady walk, try heart intervals. Walk at your normal pace for 3 minutes, then speed up just enough that is a bit hard to talk for 1 minute. Repeat this 5 times. This gently stretches the heart's capacity and improves what we call heart rate variability, which is a key marker of longevity.
And to wrap up the week?
Day 6 and 7, the recovery and connection. Stress is a physical toxin for the heart. High cortisol levels stiffen the arteries. On these days, focus on deep breathing exercises or, and this is scientifically proven, spend time in a social setting. Loneliness is as big a risk factor for heart disease as smoking. Call a friend, join a community group, or just go to a park where people are. A happy heart is quite literally a healthier heart.
I love that. It's not just about pills and treadmills. It's about salt, intervals, and connection. Dr. Michael, if you could leave our listeners over 50 with just one final thought, what would it be?
My final thought is this: don't be afraid to bother your doctor. I hear so many seniors say, "Oh, I didn't want to make a fuss over a little indigestion." Make the fuss. It is your doctor's job to help you decipher these whispers. You are the CEO of your own health, and your heart is your most valuable employee. Listen to it, respect it, and it will take you many more miles.
You are the CEO of your own health. What a perfect note to end on. Dr. Michael, thank you for sharing your expertise and potentially saving lives today.
My pleasure, Sarah. Stay heart healthy, everyone.
And to our listeners, thank you for tuning in to the Longevity Lab. Remember, those little aches, that extra bit of fatigue, or those tight socks, they are messages. Don't hit delete on them. In our next episode, we'll be talking about biohacking after 60 and how to keep your brain as sharp as your heart. I'm Sarah, wishing you a strong rhythm and a long, vibrant life. See you next time.